Have you ever finished brushing your teeth and wondered, why do my gums hurt after brushing? Well, you're not alone. Many people experience this issue, and today we're diving into the reasons behind it and what you can do to prevent gum pain. Stay tuned for some helpful tips and tricks that can make a big difference in your oral health. First, let's explore the common causes of gum pain after brushing. Understanding these can help you identify what might be going wrong in your routine. Aggressive brushing technique. Brushing too hard is a primary culprit. It might seem like vigorous brushing means cleaner teeth, but it can actually damage your gums and enamel. Incorrect toothbrush type. Using a toothbrush with hard bristles can cause irritation and pain in your gums. Dental professionals typically recommend soft or ultra-soft bristles for a gentler cleaning experience. Gingivitis and periodontal disease. Gingivitis, the early stage of gum disease, can lead to swollen, tender gums that hurt and bleed after brushing. If left untreated, it can progress to more severe periodontal disease. Improper brushing technique. Improper brushing techniques, like brushing at the wrong angles or missing certain areas of your mouth, can lead to inefficient cleaning and gum irritation. Underlying health conditions. Certain health conditions, such as hormonal changes, diabetes, or vitamin deficiencies, can increase gum sensitivity and pain. New oral hygiene products. Switching to new toothpaste or mouthwash can sometimes cause an allergic reaction or sensitivity, leading to gum pain. Correct brushing technique. Now that we know what can cause gum pain, let's look at how to brush correctly to avoid it. Here's a step-by-step guide. Step 1. Choose the right toothbrush and toothpaste. Opt for a soft bristled toothbrush that fits comfortably in your hand and mouth. Use a fluoride toothpaste suitable for sensitive gums, and avoid toothpaste with harsh whitening agents if you experience discomfort. Step 2. Hold your toothbrush correctly. Hold your toothbrush at a 45-degree angle to your gums. Ensure that only the bristles, not the hard part of the brush, touch your gums. Step 3. Use gentle, circular motions. Brush gently in small, circular motions rather than back and forth strokes. This technique helps remove plaque effectively without causing damage to your gums. Step 4. Cover all sides and surfaces. Make sure to brush the outer surfaces, inner surfaces, and chewing surfaces of all your teeth. Don't forget to brush your tongue to remove bacteria and freshen your breath. Step 5. Brush for the right amount of time. Brush for at least 2 minutes, twice a day. Using a timer can help ensure that you brush for the recommended duration. Step 6. Rinse your mouth properly. Rinse your mouth thoroughly with water or an alcohol-free mouthwash to remove any remaining toothpaste and debris. Tips to avoid gum pain when brushing. Besides brushing correctly, here are some additional tips to avoid gum pain. Replace your toothbrush regularly. Toothbrushes wear out over time, and frayed bristles can cause gum irritation. Replace your toothbrush every 3 to 4 months. Be gentle on your gums. Avoid pressing too hard while brushing. Let the bristles do the work for you. If you're unsure whether you're brushing too hard, consider using a toothbrush with a pressure sensor. Maintain regular dental checkups. Regular visits to your dentist can help catch any early signs of gum disease or other dental issues. Your dentist can also provide personalized advice on brushing and oral hygiene. Use mouthwash for added protection. An alcohol-free mouthwash can help reduce bacteria and soothe gum inflammation. Look for mouthwashes designed for sensitive gums. Consider an electric toothbrush. Electric toothbrushes can provide a more consistent brushing technique and often come with features like pressure sensors and timers, making it easier to brush gently and for the correct duration. Practice good overall oral hygiene. Floss daily to remove plaque and food particles between your teeth where your toothbrush can't reach. Combining brushing and flossing effectively reduces the risk of gum issues. Stay hydrated and maintain a balanced diet. Adequate hydration and a diet rich in vitamins and minerals, especially vitamin C and D, can support gum health. Avoid excessive consumption of sugary and acidic foods that can lead to gum problems. By understanding the causes of gum pain and following these tips, you can improve your oral health and enjoy pain-free brushing. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more dental health tips. And don't forget to hit the bell icon to get notified whenever we post a new video. Thanks for watching and take care of those gums.